Very briefly, we are disease-specific for pheochromocytoma and paraganglioma, Pheo para for short. There are over a dozen genetic mutations that can be attributed to Pheo para, and about a third of the patients that are diagnosed are a result of a genetic mutation. Organizational history, just very briefly, last year, Pheo Para Alliance and Pheo Para Project, two organizations dedicated to Pheo Para, merged, and we kept the name Pheo Para Alliance. So now we focus on advocacy, education, empowerment through peer support, and facilitating research. Very briefly, just earlier this month, we had our Pheo Para Alliance conference in Syracuse, where Matt, our president of the board of directors, is. He works at the Upstate Cancer Center, so we were able to get a lot of in-kind support through that. 160 attended in person. That was over 2 days. So it was actually 75 patients and their family attended, which we were so happy with. The last time they held a patient conference was a couple years ago, and about 100 people attended via live stream. So, and between 15 and 25 healthcare providers attended in person, and we had a number of healthcare providers attend via online via live stream as well. We offered continuing medical education credits, and now we're in the process of posting that content online. The content we had previously was relatively old, so this will be a really great resource for our patients. Takeaways real quick. A number of the board members who've been around for quite a while said the research that's going on and the information that was presented is new. They said for a bit there was a lot of rehashing of information that was presented, so that was very exciting. The other jaw dropper I think that we've had a lot of discussion about was the population risk that we currently present to our on our website and in our materials is 6 to 8 people per million will develop a Pheo Para in their lifetime. The information that was presented at the conference mentioned that the population risk is 1 in about 4,500. So a huge difference in population risk. So as an organization, we're in the process of evaluating that and probably changing our population risk numbers. On the horizon, we have, she makes me so nervous when she walks up here. We have Facebook Live webinar series coming up at the end of the year. We also have a Pheo, they used to call it the Pheo Para Doctor Tracker, which I'm not crazy about because it identifies one doctor, which as we know, we all need a multidisciplinary team, so we're probably gonna change that to centers, so we're gonna revamp that. And also, I was brought on board to build capacity for the organization, so we're really trying to build what we call our Pheo Paratrooper Army. One of the ways we've done that is with Pheo Para Fridays, where we feature a patient. I'm so sorry if I'm talking too quickly. And then very quickly, I just want to mention on the research front, I was just approved by the board just to mention this in a generic way, but we haven't signed a contract yet, but we are looking into a research project along with 2 other Pheo Para foundations with to fund a project that will help develop a Pheo Para cell model, which we don't have, and to use CRISPR technology to test the tumors. Patients will donate tumor tissue, and they'll be studied to develop a cell model, and then use drug repurposing technology to see if any approved drugs, not cancer drugs, can be utilized and be effective in treating Pheo Para tumors. So that's very exciting. It's a minimal amount of money with 3 groups and hopefully a maximum benefit. And then in the long term, another aim is to create a Pheo Para dependency map that says, if you have this genetic mutation, you can take this therapeutic. So that's very exciting. A big, huge, lofty, ambitious project, but we're hopeful that it pays off. Thank you.